Broadcasting from Silicon Valley, California, this is Conversations with Jennylyn.
You are watching Conversations with Jennylyn, and today I am continuing to bring you people from different parts of the world. My guest this morning is Dr.Hardyal Gill, who is better known as Sunny. Sunny lives in the UK and he is a dermatologist. So he will share a little bit about his work with us, and then we will discuss the coronavirus. And I'm very happy to have you join me on Conversations with Jennylyn today. Thank you for taking the time and welcome.
Welcome, Jenny. It's evening in UK, and I'm very happy to have conversation with you.
I noticed we have a third person in this interview. Your glass of beer.
I mean, Jenny is UK, and
of course I know the British and their beer.
Yeah, in evening we just either drink it or just go to pub and just
but
enjoy ourselves.
You can't go to the pub now, can you?
Yeah, that's what I'm drinking at home,
You brought the pub home.
Yeah. Yes.
Great. What? You have to drink your beer, so if you can't go where they sell it, you have to bring it where you have it. By the way, strange question, maybe not so strange. Is it a corona?
Of course, it's just corona is everywhere, and we are under lockdown,
No, I was asking if your beer is Corona.
Oh.
You see what's happening? People are forgetting there's a beer called Corona. People are only
Yeah, I know. Yes, yeah. There's a beer called Corona as well, but my favorite is my best beer. I like it, Asahi.
What is it?
Asahi is a Japanese beer.
Oh yes, I
know.
Yes, it's nice.
Yeah, and also, I like exotic beer, more than European beers. I mean, one of the other I like Singha beer as well. I like Cobra as well. They're all, Eastern exotic beers,
Right. Well, I like Boddingtons. There you go. And Guinness. Strange enough, for a woman, I like the heavier beer, but those are two of my favorites.
Yeah.
So let's talk about why we are here. You are a dermatologist in England, and in a previous conversation, you indicated that you have the leading skincare products in the world. That's a huge claim. So tell us about that.
I mean, I want to clarify you. I'm not a dermatologist. I'm not a doctor, but I'm a scientist who is working in, most of my products are for dermatology on skin, and I also have some product, which you can take it orally as well. So I'm a scientist who is working in nanotechnology. And
your skin profile lists you as a doctor, though.
Oh yeah, because I have a PhD.
Oh, I see. Got it. So you are a doctor, you're just not practicing medicine.
Yes. So I'm a nanotechnology scientist.
Okay.
So I'm working on lots of products which are meant to be used on skin. Okay. So I'm working on lots of skin disease, So there you go,
Well, that's my field. I used to share a medical cosmetic clinic with a friend, so I'm familiar with the skin and how to take care of it. So I'm excited to hear about the products that you're working on. And why do you claim that it's the best in the world?
Okay, yeah. Well, initially when I started in nanotechnology, my field is drug research, and then drugs, delivery through skin. That was my field where I work in UCL, so that's why I did lots of research, So, I mean, I never think of cosmetic at that time. So, because, when you work in that field, drugs, so I come across with one of the doctors and one of my very good friend, Dr. Jennylyn, who is also a cosmetologist and also very good. She's very famous in cosmetics. And she's very good in liposomes. Dr. Jennylyn.
Okay.
Yeah. So then somebody told me that why don't you develop something in cosmetics? because cosmetics is a new field. Nobody does research in cosmetics. Yeah, everybody is doing research in drugs, and cosmetic is very new field for liposomes and for nanotechnology. And I said that's fine, So then I started looking cosmetics, and one of the thing is, if you see cosmetics, yeah, and if you ask any dermatologist, there are three things which are top in the dermatology.
Yeah.
One is anti-aging, and other is skin lightening, and third is skin cancer. So
Right.
these are topmost things in dermatology. So I started with the skin lightening cream, skin lightening formulation, and then I developed skin lightening cream based on nanotechnology.
Yeah.
So then what happens here in roughly year 2017, yeah, then I thought, well, let's go and make it commercialize this formulation. And then I was going everywhere in Europe and approach many liposomal company who make liposomes, and they are doing work in nanotechnology. And there are, roughly there are like three companies in Europe who works on liposomes.
Yeah.
But unfortunately, they say that we cannot make liposomes for skin formulations, because most of the liposome, if you see in the world, they are for intravenous infusion.
Right.
So they give you liposome directly into your vein, but they are not for the skin. Yeah. So lots of research is happening, but there is no actually formulation in the world which you can use liposomal technology for drug delivery through skin. So they are not very helpful at that stage to me. Then what happens? Then we end up setting up our own plant in India. So we have a plant in India now. So we got license as well. That's the other story.
Got it. So to date, what products do you have? Because I don't want to make this interview just about the product. So just tell us, what products do you have currently that are being used? Do you have
Yeah,
any?
yeah. Our first product is Q Nano Fair. Is a skin lightening and anti-aging cream. Q
Okay.
Nano Fair. Yeah.
Yeah.
So we got license as well in India, and we got some sort of we got some flap due to licensing issue as well. Because if you see, most of the liposomal formulation are in drugs, not in cosmetics. So when we set a plant in India, and when we apply for license, we got lots of questions from inspectors, and they are saying, well, this yours is cosmetics, and you're claiming that yours are liposomes, and liposomes are not cosmetic, they are drugs. And I say, well, you can use in liposome cosmetic as well, so they're not drugs. So we got lots of issues, and eventually it takes lots of time getting license. So at the end we got license, and we are ready with every front.
How long did it take you to get the license?
It takes roughly around 8 to 9 months, which is very, frustrating at some time. And because, we have to we discuss with the inspectors and trying to convince the liposomes is, lots of big companies, they use liposomes, like a L'Oreal, Lancome, Nivea, they use liposomes especially in their anti-aging creams, when they deliver various serums.
Right.
So what happens, and unfortunately, not many cosmetic companies, they are using liposomes. Only the top companies, they are using liposomes. So there's a misconception in the cosmetic industry that if you're using liposomes, they are a kind of drug, but they are not. So now we have unit in India, and we have licensing as well, and we are ready to launch our cream. And then what happens? Yes, tech bang in the middle is Corona comes. So that's why I like to discuss with you how Corona affect us, people who are startup, in a cosmetic industry, how this Corona affect us, sir. So before Corona, we are about to launch our cream in many countries. I have a discussion with a few of my links in USA, and then in UK as well, and also Europe, and South Africa, and also the Malaysia, and also Australia. So what happens? We are discussing and we are having a last time deals. Yeah,
Wow.
and I was about to launch our cream, the Skin Affair in London, in April. And step back, what happens? Corona comes in middle, and everything stops. So this Corona hit us very badly. I'll tell you, I can't even think in million years that this thing will happen to us. You know, but it happens.
Well, I hate to tell you this. I'm sure you won't be surprised. You are not the only person whose business is being affected, and I'm so sorry that everyone is, having to put everything on pause. The
Yeah.
good thing is you just get to sit and maybe you can use this downtime to
Yeah.
really plan your launch carefully so you're not really wasting time. And then when you do launch, maybe it will work perfectly. You won't have any hiccups because you now have the time to sort of
Yeah.
plan carefully when you launch to have all your I's dotted and your T's crossed. So congratulations, and I wish you well. I'd love to try your cream.
Yeah, of course. I'm going to send you our cream, Q Fair, as a sample
Oh,
because what happens here, we are going through the registration process. It's called CPNP in Europe.
okay.
This kind of registration process before you launch cream.
Right.
So I am doing that. Yeah. So the same procedure you apply for FDA. So it's kind of like you have to inform FDA that this is our cream and this is ingredients in our cream and this is a safety assessment for the cream. And then they say, okay, so we will go through the procedure, but I can send you as a samples, definitely, So
Thank you.
try your cream and I'll assure you, you'll forget all the other creams.
Oh, great. I can't wait. And if
Yes,
that is true, maybe I will invite you back on my show
of
and
course, of course.
talk about
Yes,
how my experience with it.
yes,
So you live in the UK. You're originally from India, I can tell, because you sound
yes,
like you're from India. And you have an
yes,
Indian one. So
yes.
how long have you been in the UK?
I mean, I am here from last, God, like age is basically 30 years,
Oh,
you
okay.
know.
Right. So
So I kind of forget India, like what's going on in India and a lot of, where you live for that long, you become part of that country.
yes.
So yes, so that's what happens with me. But now I'm more associated with India because we set a plant there, and I'm very much looking forward for India. And India is a growing country, as it's very good in pharmaceuticals, and it's very good in new drugs and in new developments.
Right.
And yeah, so unfortunately, India is under lockdown now. So
Everyone is.
yeah, that's kind of very depressing to me. Like
Well, sometimes we are forced to do things that we won't necessarily do, but we probably need to do. I feel like it's what is bad about the corona is the number of people suffering and dying. But I feel like for me, it's forced me into introspection. There's so many parts of myself I find myself looking at. Had I been running around with my regular routine, I don't think I would be doing some of what I'm doing now. And I suspect it may be true for a lot of people, including yourself, right? Is
yes,
that correct? I'm sure you're finding a lot of time to focus on you apart from your various projects.
I mean, we have lots of products under pipeline. So this Q Fair is our first product, skin lightening and anti-aging cream. And beside that, we have a hair serum, which is also hair growth serum actually, and it's based on nanotechnology.
Oh,
So all our future product will be based on nanotechnology. And we have anti-aging cream as well. And we have something for vitamin D as well. And that comes under nutraceuticals. Because if you see, vitamin D is a massive problem around the world. It's massive in Europe and lots of big, huge problem in Canada and as well as in America. And believe me or not, it's also a big problem in Middle East. Where they put like a black, they cover themselves and they don't go out. So it's a messy problem in Middle East as well. So my approach is nanotechnology delivery for vitamin D. And if you see, vitamin D is a very important vitamin for body.
You know what? We are going to do another segment where we're going to go in depth about your line of products. I want to talk to you a little bit about the corona, and believe it or not, half of our time is gone.
Oh,
Do you believe how quickly the time flies? When
I know, I know.
So you don't have an accent, a British accent, for living in England as long as you have.
I mean, well, you can't change your accent,
It's true, but I have been
very
living
difficult. It's very difficult.
living in California maybe just 3 or 4 years longer than you've been in England, and I've met a lot of people who are Indians who've moved to England after you, and they have a British accent. So I think it's really cool that you've kept yours. So what is it like for you in England during this time of the coronavirus?
I mean, I would say that what the British are doing, British government, they are excellent. I don't have any complaint because they are very organized. This country is very organized. We got the home delivery. We also get, food packages from government free,
Oh, really? The government
Yes,
is sending the people of England free food?
free food as well every week, So
Wait,
it's kind of like this big package,
yeah.
and there are lots of things in the package. And I don't have any complaint about, I can't about British government. They're excellent, and they're putting lots of money in business, and they're trying to support whatever, they can, they are doing it here. They are doing their best, basically.
Awesome. So someone comes to your front door, rings your bell, and gives you a package of food.
Yes, they do, every week. Yes, that's one of the things, because I'm living with someone who is, very vulnerable person. So it's not everyone, but someone who is very vulnerable. The government is giving them food, and in the package, if you see, there are lots of stuff in that, So kind of like something you can use within a week, like whatever you need it, including soap as well. And there are so many toilet paper, not forgetting toilet paper as well, so kind of lots of things,
The
and also,
luxury item, toilet paper.
yes,
I
toilet.
still find it so funny, this big hoopla around toilet paper.
It is actually funny, because if you have a natural calamity, you don't go for toilet paper. You can live without toilet paper. What you need is a food. You can't live without food.
Right.
But I don't know what's people mentality is. They are running after toilet papers, So I think this is over now, this chapter of toilet paper. But I'm just saying that, I'm very happy with British government, what they're doing. They also, they raise,
Before you move on, I just wanted to clarify for anybody watching this show. So what you're saying is the food that's being delivered to homes are for people,
yes,
are for households where they have vulnerable.
even old person, yes.
Oh, but
Also,
it's not every single person in England that the government is doing.
not every single person, but
Okay.
yes, ordinary people, they have these home delivery slots, and also even the medicines are delivered at home. We don't have to go out for medicine; they deliver at home. So I think the service and the way they are doing this in things in England is good. I don't have any complaint.
That's great. So do you know what the numbers are today? Like how many contaminated cases, how many deaths? Is it plateauing? Is it elevating? Do you know?
Yesterday the case was a little bit down. I think this, I can't say because I'm not government spokesman.
No, but
Yesterday.
I'm just asking you from what's been published.
Yes. So yesterday was 700 something. 690 or 700. But today they're going up again. Is 760. So they are going up and down.
Deaths for contaminated cases. 690 deaths or 690 cases of contamination.
I'm talking about deaths.
Oh.
Cases are much higher. So, sorry, just deaths, 690. And today were a little bit higher. They were, I think, today was by 4 o'clock, it was 760. So it's kind of like going up and down at the moment, But my thing is like, as a scientist, what I feel that the reason we have that many cases because we are under lockdown. And if you remove lockdown, you know what will happen? Yeah, the coronavirus will spread. And instead of that, this much case, we'll have more case. So what government trying to do is, I mean, they don't have any other option in their hand, because I can understand. There is no an effective antiviral, there is no vaccine. So the only thing they can do it, this lockdown. So what they are trying to do is a lockdown, and they release lockdown, and then lockdown again, yeah, and they release the lockdown and lockdown again. So they're trying to do it like in a control way. So the people, inevitably, people will be infected. Yeah.
But as a scientist, how do you feel about that? I mean, what I'm hearing you say is they're doing a lockdown and then they're releasing you to go back out, and then they do another lockdown and then they release you to go back out. But as a scientist, what is your opinion? Do you think that's the most effective way to try to control spread? I'm just asking you because I don't know. How is that working out? Because I've heard of situations where in countries, because I've been interviewing people now for a while, when you let the people go back out, sometimes they're carriers and they come across people, they're not being affected, but then they spread it. And so that's continuing the spread. As a scientist, what do you think of that? Do you agree?
I mean, I have my own opinion on that.
Well, that's asking you. What is your opinion on that?
Yes, I mean, most of the time, my opinion is perfectly, exactly good, you know. But again, you know, what I feel that whatever vulnerable people are there in society, they will get corona anyway, whether they get corona in 6 months down the line, year down the line, 2 year down the line. Yeah, what government is trying to do, unless we get some medicine, effective antiviral drug or vaccine, yeah, then it's a different thing. But if you don't have, then what government is trying to do, they don't have any option in their hand. The only thing they can do is lockdown. Yeah, and they're doing in a controlled manner, so that the people who go into the A&E or hospital, they are under control, so they can treat, they have a chance to treat people, so they have chance to recover people. So that's what they are doing. So in my opinion, what will happen, and it's not only England, around the world, you'll see what happens. There will be corona cases spike up, you know. So what they're doing, they are going to do lockdown and release lockdown, lockdown, release lockdown, and they will do it for next 2 years. So we are in a very difficult situation in the world now. This virus won't go out like this. Yeah, the only option you have in your hand, you can either have an effective antiviral drug, yeah, or you can have a vaccine, yeah, or third thing is trying to release virus in a controlled way. So how can you release virus in a controlled way? Is by lockdown. Yes, even inevitably, yeah, if you don't have vaccine, if you don't have antiviral drug, so inevitably it will affect people. Yeah, and people will be sick, and people will be very, very sick. Yeah, so what they're trying, government around the world, they're doing is in a lockdown cycles. So I think it will go on for at least 2 years.
We
And
haven't
that's
been
very,
doing that in the US. We
I think
haven't
this
been
is a,
doing a lockdown in cycles. We're doing a lockdown. We've been on lockdown, I think about 6 weeks now. We
I
haven't
mean,
had a release back, and I feel based on our numbers, it seems like it's working for us. So I'd be really interested to hear how your secular lockdown system is working for the country.
I mean, what happens here? There you have to have a balance between two things. You have to have a balance between the people who are sick, and they have to have balance of economy. You
Mhm.
can't leave economy to go down, you know, free fall. So what the government is trying to do is just trying to have a lockdown and release lockdown, so that they can release the economy, so economy will be better, and then again lockdown again. So it's kind of, they have to have balance. There's no other way. So you will see the countries who release the lockdown, the cases of a corona virus will increase. You know, there will be spike.
Yeah.
That is inevitable, you know. So you can't stop it. Yeah. Then they will do it. Then they'll lock down again. So what they are trying to do, they are trying to do in a controlled way. You know.
What kind
So
of results? Your prime minister was in the hospital, in the ICU, because
yeah.
he was very ill from the corona. Prince Charles, we read and has been reported, was also infected. Do you think your lockdown and release is probably one of the reasons why some of these people got the virus? I mean, the virus clearly does not discriminate. It doesn't care if you're a king, if you're a queen, a prime minister. If you are somewhere where it is and you don't have a really strong resistance to disease, then you end up suffering from it. But do you feel like, as a scientist and someone who understands science better than we do, because this is your expertise, do you think that's a great way to control it?
I mean, we don't have any other option. Yeah, that's the bottom line. We don't have any other option because at the moment we don't have any effective antiviral drug. There are some reports that, well, I mean, the hydrochloroquine works. You know, I'm not denying that. You know, I'm not saying no. That's fine. Yeah.
Does that mean you're saying yes? So are you agreeing it works? It helps? Because you said you're not saying no, so I'm just checking. Yeah.
Of course, yes, because I have read some reports where it is effective because, you know what, this is an antimalarial drug. And I mean, other reports I have read is BCG, you know, believe it or not. Because
that's been my comment. Yeah, I've been asking everyone I've interviewed that because I am someone who was raised in a British territory.
Yes.
And we were all given the BCG. And you couldn't forget that you got it because it leaves a scar on your upper arm. And
yes,
life,
you have scar on my arm.
Oh yeah, mine is on my upper arm. But throughout my life, if I wear clothing that's sleeveless, I've been asked, what's that scar on your arm? And I go, oh, it's from a vaccine. And most people don't know, don't understand it out here in the United States where I live. But what do you think? You think it's helping?
I think there are some there are some link, I would say, yeah. Because if you see the number of cases in India, okay, cases different, yeah, the cases can be million, yeah, yes. No problem. Right. But then if you see the number of people dying in India is very low. It's only like today I was reading, it's only 450, you know, in
That's
country
amazing.
of, yeah, 450.
Yeah.
Yes, of country of nearly 4 billion population. What I feel, there is two links. One is everyone has BCG in India. Yes. Second thing is, I read a paper where they say that Indians people, they have some sort of like a resistance towards the coronavirus. Yeah, they have messenger RNA, some sort of special protein which kills the virus, and then it doesn't make that much active. So I am certainly, convinced that there is something in India, in that continent, where people, although they have infection, the infection will increase eventually, but they may not have that many deaths. It's all due to either BCG or due to something they have in their messenger RNA in their blood.
Well, you and I share the same opinion on that, because I've also noticed that in my country, we haven't had as many fatalities, although we've had quite a bit of infections. And I was trying to think, because I'm doing this series where I'm interviewing people around the world about this virus. And the common thread that I have seen, the countries where the people were given the BCG, they haven't got as many fatalities. And when they have had the fatalities, when I've checked, there were older patients who were compromised that passed. These people were already compromised because they were suffering from either a terminal illness or they were already suffering from some form of an illness. So then when they got the virus, they died. But for the majority of the people, even though they have contamination, they're not dying as they are in other parts of the world where the people were not given the BCG. So I am inclined to share your view that the BCG is somehow playing a part in helping to resist this. Because India is a poor country, as is Guyana. These are well, I don't know so much for India, but Guyana is definitely third world. And so I think it's great if the BCG is helping, because I think it will help to keep the fatalities low.
Yeah, and I think I can't confirm this news because it's not good if I can confirm the news. But I read in many different news where I read that Chinese government they give BCG injection to their population.
They do, or
Yes,
they did, because a lot of
yes,
people have stopped it.
yes. So they did it last year before this pandemic happens. That's the other reason they don't have that many casualties.
You don't think China has a lot of casualties?
I mean, compared to the size of the country, if you see the size of the country, they only have 3,000 roughly casualty, yeah, because they did BCG. So I believe that there's something is there, BCG.
Hard time believing that 3,000 number. I interviewed two people from China on Sunday, and they told me that. And I thought perhaps they didn't understand the question. I mean, and I've looked, and aren't you surprised that China, where this disease started, and the disease seemed like it ravaged that country, that they would only have 3,000 deaths and for the entire country? Do you think that number is correct?
I mean, I can't say for sure, because the historically Chinese are very secretive, but still, whatever is there in the internet, in the media, so we'll go on that. So they say that roughly they have 3,000 deaths. Yes, but 3,000 is very low compared to the size of the country.
Yes, absolutely.
So yeah, so I can't confirm. It's my opinion that BCG play a role, in
I didn't
fighting.
realize the Chinese were given the BCG as well.
I mean, that's why I heard
yesterday in Germany, and he told me they stopped giving it a long time ago in Germany. And I should have checked. I don't know if they're still giving it in Guyana. Do they still give it to people in India? The BCG?
Yes.
Oh,
yes,
they're still giving it.
BCG, yeah.
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 I
That's
wonder the countries who stopped. I wonder why they stopped giving it.
I mean, because it's more prevalent there. This is not like a BCG is very prevalent there, like a tuberculosis is very prevalent in India. So you're bound to have these sort of vaccination. Is a part of like growing up. You give a vaccination to a child, and there is some link between that and the corona. I would say. So I can't say for sure, but this is only my opinion.
Well, we have the same opinion, and I don't want to corner people. Almost everyone that I've interviewed in every country, we've had the BCG discussion, because somewhere inside of me, I am really convinced it's helping. And only because I grew up in Guyana and I know the medical, I went to nursing school there. I went to school there. I had most of my education there. And I know the conditions, and I know that something like corona would just ravage the country. So if we've had as many contaminations, but not as many fatalities, what is it in that country that's helping people to recover or resisting the virus to where there aren't as many deaths? And now you're telling me the same thing about India. I am really starting to convince myself, just based on this information, that there has to be some type of a correlation. There must be something in that shot that is resisting the virus when people get it and saving lives. And I hope it's true, and I hope that they have studies down the road that can confirm this for us. We're almost out of time. What would you like to leave with my viewers before we wrap up?
I mean, I can say that things happens in the world. Yeah, be strong, and then we have to go through this time. Yeah, whether it's good or bad. I think we have to go through. I mean, I really hope that we'll be over this corona, because we are the one who are suffer very badly. As a startup company, we hit very badly, and I just hope that it will be over soon. But I'll tell my viewers that just be strong and be hopeful in life. It will be over soon. Yeah.
Last question. What have you learned about yourself during this lockdown?
I mean, this is like it's like someone who is sleeping and somebody put hammer on the head, it's just I mean, I can't even imagine that somebody will hit me like this, like Corona, but there you go,
So that was our
we are
time.
here.
We were great. We stayed within our time. I am so grateful to you for taking the time, Sunny. Good luck with your company and your products. I can't wait to try it.
Yes.
I'm sure it's great because you say it is, and I'm taking your word for it.
Yeah, of course, yes, of course. Yes.
And enjoy. It's evening in the UK,
Yes,
now, right?
yes.
Enjoy the rest of your evening, and I will be in touch with you. And thank you so much for watching Conversations with Jennylyn. As always, my hope is I'm bringing you inspiration and I'm bringing you knowledge and hopefully something that you can apply to your life to make it better. And thank you for watching Conversations with Jennylyn, when a conversation is all you need to be inspired. Thank you. I'll be back and I'll see you next time.
Broadcasting from Silicon Valley, California, this is Conversations with Jennylyn.